Hello, everyone. It's November the 2nd, and today, regretfully, I've still got to start with calling off some great West Virginians that we've lost. 7 more since Friday. Our 452nd death, a 62-year-old male from Fayette County. Our 453rd, a 70-year-old male from Summers County. Our 454th, a 76-year-old female from Logan County. Our 455th, a 78-year-old male from Cabell County. Our 456th, a 91-year-old male from Cabell County. Our 457th death, a 79-year-old male from Kanawha County. And our 458th death, a 71-year-old female from Grant County. I'll talk a bunch more in just a second about this, but I just want you to know that if you'll watch the national news, if you'll watch what's going on as this terrible killer is still right with us and sweeping across this nation, I want you to ask yourself just these questions, or really just one question. What in the world would we have done? How would we feel right now if we had not made significant advancements in the drugs to be able to treat this terrible killer? What would we have done with the numbers that we're having today if, in fact, we did not have the drugs that we have today to fight this terrible, terrible epidemic or pandemic? How would we feel? Would we all be shut down? Would we all be scared totally to death? And yet, for the most part, most of us are concerned. Most of us are doing the right stuff, but most of us aren't really concerned to the level that we really truly should be. Now, we got to go on, we got to live, and we got to live with this. We got to do things like celebrate an incredible victory at Mountaineer Stadium this past Saturday with probably 20,000 people there. We've absolutely got to go on with having our kids in school and hopefully playing a Friday night football game or a volleyball game. We've got to go on about being able to associate and communicate, but we can do every single bit of what I'm telling you if we'll just try with all in us to take precautions as we do these things. Now, we know we're on what we hope and pray is a short fuse until we get to a vaccine. We hope and pray that that's really close and that it's coming sooner than later. You cannot let these 7 people that we lost today and the 458 total become just a number. You can't become numb to this. And I'm going to challenge you again, West Virginians, just this. Today, our positivity rate is at 4.19. That's too high. Still an incredibly good number if you're looking at it from the standpoint of our entire nation, but it's too high. Our cumulative number is at 2.95. Our active cases are at 5,557 now, with our recovered cases at 19,220. We have eked up just a little bit more in the number of hospitalized. We are 254 now. Our effective reproduction number, our RT number, is 1.10. We're still the 17th best in the country. And we've got lots and lots and lots of counties in the orange and one county in the red, Mingo, in the red. And in the orange now we have Berkeley, Jackson, Marshall, Mineral, Ohio, Putnam, Tyler, Wayne, Wood, and Wyoming counties. Now, before I go any further, I want to just tell you just as straight up as I know how to tell you, because I think you really entrust in me to tell you the truth, and I'm going to continue to do just that, because I know that's what West Virginians want to hear. They want to hear straight talk. They don't want to hear a politician talk. Here's the real straight skinny. When it boils right down to it, what I have done now, I have taken even a more drastic step in trying to provide testing, and our National Guard, DHHR, local health departments, and everything else are now being tested beyond belief and being stretched beyond belief. And from the standpoint of the dollars, the pure commitment of dollars from your state, it is astronomical. Astronomical what it is costing in pure flat dollars. Not only what all these great people are doing. Now, and here's where it gets tough, and here's where it gets just straight talk. You got to show up and get tested. For crying out loud, if I'm willing to commit the dollars, and if I'm willing to put a stake in the sand and say, by God, we are going to absolutely test, and we're going to make testing available to where you don't have to run all over Kingdom Come to be tested. We're going to make it so easy it is unbelievable, but you got to show up. You have to show up. Now, I know there's people out there that are worried. And here's the concern a lot of times. People are saying, well, you know, if by chance, and I don't feel any symptoms at all, but if I go get tested and I would just happen to test positive, you know, then I would have to maybe set out of my job for 3 weeks, and I can't afford to do that. And that is a possibility, I guess. But here is the absolute truth of the whole matter. This is not a scare tactic, it is just the truth. I am not a doctor, but I think that if you would ask any doctor, any in the land, they would tell you this. First of all, if you're asymptomatic, the odds are you're going to get sicker. Now, so if in fact you don't feel anything today, you may be getting ready to get really sick. So why not be tested? The second thing is just this, is if you don't ever feel any symptoms of sickness and you are asymptomatic, you're infecting your loved ones and they may very well die. So why not be tested? And the other thing is, if you don't ever feel any symptoms and you would not ever infect anybody else, which is totally impossible because you will infect others. If you don't feel any symptoms, though, at all, absolutely down the road, the probability of you months later developing some level of problem, a heart problem or a lung problem or whatever, a chronic problem that you could have avoided by getting tested and getting some level of treatment now. Why not get tested? Now look, if Jim is willing to absolutely commit the resources and to push our National Guard and our health department and our DHHR and all the people to really get after it, you got to show up. You got to show up because we can't stop this thing. We can't stop it if we don't know. Now, from the standpoint of getting our kids back in school, it'll help. From the standpoint of us having the ball teams being able to play, it'll really help. From the standpoint of us being able to know who you are and where these spreaders are coming from and stop it and help those people and help them to stop spreading something that is eating us alive, it'll do it. You got to show up. You got to show up. I've been tested probably approaching 15 times. 15 times. So absolutely, please just show up. Please. I'm going to switch channels 180 degrees almost. I'm going to tell you just this, but our official revenue numbers of October are in now. You know, we gave you the preliminary stuff on Friday because Saturday was the end of the month. We've increased and we've gotten even a little better since then. But the numbers basically are now, instead of 20.4, we are 21.3 million ahead of estimate in the month of October. That's all great stuff. I'm not going to go through all the different things and everything, but that puts us year to date at $111,700,000 of surplus that is above estimate by a percentage of 9.8% above the previous year's receipts, and the previous year was at a time when we had no pandemic. If you'll look back to July, August, and September and October of last year, we didn't even know about this pandemic until February. And so to be 9.8% above that is quite a feat. And not only that, remember, in addition to this, we have got an additional right at $200 million. I think the total is $298 million of cash surplus in the state of West Virginia when we moved the income tax. And so, trust me when I tell you just this, we're doing it in West Virginia in a positive way. The economics are moving in a very positive way. And from that, we're going to be able to just continue to help lots and lots and lots of people. And we are recording these surpluses at a time when there is a pandemic and at a time when really we are comparing these numbers to a record in the past year. And so we are comparing numbers of a record surplus to again, I mean, that's what we're comparing against. And so it's just phenomenal. And it's really good. I thank all the businesses, I thank all the great people that are putting in the licks out there, doing the work and everything that you're doing everywhere. And absolutely, I want you to know we're going to continue to turn every rock to try to make sure and try to help every person we can possibly help out there in the state of West Virginia. We're not going to quit until we're done. But I especially want to thank all the people in our revenue department that we work all the time together. We meet almost every day, and for many, many, many days, we met every day. But it's good stuff. I've been through the free testing. You can see that, that'll be up on our website. Same with our drive-through pharmacy testing. And I can't possibly encourage you enough to go get tested. Please just stay at that. I did want to read that. I read through all of it. Okay. The Saturday education map. On the Saturday education map, we had 1 county in the red, 5 in the orange. They were Berkeley, Morgan, Upshur, Wayne, and Wyoming counties, and 10 in the gold. And I'm not going to read through all of them right now. We had 23 outbreaks in our schools. We have 95 confirmed cases in the public schools that are reported to the Department of Ed. That's a very, very low number, but we want it to be 0. And we continue to try to make that atmosphere the very, very best we can possibly make it. Our long-term care facilities, we have 47 outbreaks there. We have 15 outbreaks in our churches in 12 counties, and I always want to read these counties because I think it's really important to the people in these counties to be super, super careful, super careful. That's Cabell, Doddridge, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, Wayne, Wetzel, and Wood counties. All of them, have outbreaks in churches right now. We've got to be super careful. Keep a pew in between you. wear your mask, and wear your mask, and absolutely just be really, really careful. If you happen to be an elderly person, think about it. Maybe it's a time to take your services online and just be really careful. I mean, we can still go to church, we can still go to a ball game, we can still do these things if you'll just absolutely protect yourself and don't become numb to the whole situation, because and I know too that you go places and people ought to have masks on, and they don't. And absolutely, you don't want to challenge people and everything else, but wear your mask and really, I don't think that it hurts anybody to stand up and just say, you guys ought to have your mask on. I mean, that's not a great big deal. From our corrections, there have not been any active inmate cases since Thursday. We still have 10 active staff cases. I want to remind you over and over about the flu vaccines. We're just under $169 million that has been awarded to our cities and our counties. We continue to take the applications and continue to process and get those dollars, awarded and in the pipeline going back to the cities and counties. I think that's been, I know it has been a lifesaver beyond belief to our cities and counties, and so we just want them to continue to thrive. I've had the opportunity to give a few grants away. I gave away a $500,000 grant today in Rainelle for their sidewalk reconstruction and everything there. And that community has been through what and back. I mean, you just think about it. They had a derecho that hit in 2012, which absolutely went right through the middle of that town. Then in 2016, they had the horrible flood that we all know and experienced and everything. And then right behind it, they had snow blizzards and everything, and now a pandemic. So, I mean, that little community has really faced a lot of adversity. I've got a great friend there that served as their mayor for many years and did a phenomenal job, and it's Andy Pendleton. It's the captain of my detail in the state police, Drew Pendleton. It's his mom. She was there today, and really, really happy about the grant money that we got for the sidewalk, and FEMA came through, on 3 generators that are coming into the town, and that little town is coming back to life and everything. It's a beautiful little community, so I'm really, really tickled for any of our communities to come back and just do more and more and more, because it's great for our residents, it's great for tourism, so many different things. Last thing I'm going to report to you is we got the CARES money that is the $25 million is set aside, for the March 1st through July 31st payment. I got a note from a lady the other day, and I'm going to mess this up just a little bit, but she was just saying that this meant so much to her because she didn't know what to do. She had these delinquent bills, and she didn't know where to turn or what to do. And she said, she just made reference to the fact that tears were running down her face, and she was just so happy that this absolutely helped her and helped so much. Honest to goodness, I don't know how it gets any better than that. Really and true, when we're able to help somebody, I mean, I've said it 1,000 times. When you're able to absolutely help someone, I don't know why anybody could want any more. I mean, really, that's what the good book teaches us all the time. It's so significant to be able to just reach out a hand. You don't have to hand somebody a bunch of money, but you absolutely have to reach out a hand of care and love. And so try to remember to do that. Do it every day. It'll surely make you feel a lot better. I mean, at the end of the day, the giver is the one that always wins. Always wins. If you'll step up and give, it makes incredible things happen in your life. And so anyway, that's all I've got right now. We got to really bear down, get tested. I need you to do that really, really, really bad. Thank you.
All right, thank you, Governor. Let's first today go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. The governor has shared with us some very sobering information that we should take into account, not only in our brains, but also in our hearts. This last week, the United States posted the high single day total for number of positive coronavirus cases of any single day from any country in the world. It was 99,000, almost 100,000 a single day. We averaged over 80,000 new cases for the first time ever in the United States last week. We know that coronavirus, when it first affected us in certain areas. New York, Texas, Florida, Arizona. Now it is affecting us everywhere. Many rural communities like the Dakotas, like Kansas, are posting 30 to 50% positivity rates. Many people have noticed when they look at West Virginia's metrics, if you look at our infection rate, many of our counties are in that red area and the percent positive rate's better. And as we've explained, one of the challenges that we saw initially using that infection rate alone was that people didn't want to get tested. People were afraid of having those new cases identified, and we were doing less than 3,000 tests a day. And as we talked about, we really want to be doing more like 8,000, 9,000, 10,000, 11,000, 12,000 tests a day in that range, so we can identify people who have COVID-19 and who may not know it, so that we can separate them, the spreaders, reduce the spread in the communities. But even with that said, and the fact that the percent positive rate, if we do our testing, is always going to be lower, which is good because we'll be finding those people. But it is absolutely true that when we look at some of our counties, we are in a very high rate of spread as we look at those counties. And the governor's detailed that he has asked all of us to really, really enhance the ability to test people so that people can know, so that people can be protected, so that we'll know if you're sick, so that we can give you help, but also so that we prevent you from spreading it to other people. And I think that the key, and this is really the end of what I want to say today, and we've all said it in different ways, but I'm going to try to say it really as clearly as I possibly can. The challenge is today in the United States have approaching 1,000 people in hospitals. It's not just dying of COVID-19. It is taking up hospital level where other acute illnesses like heart attacks and strokes and other problems become more problematic because, eventually we may not have the room. And we've seen that in Wisconsin. We know that El Paso, Texas has just ordered their third portable morgue vehicle to come in to help them, as we saw in New York City. So it is really not only our responsibility as the team that is trying to help this state, and the governor's responsibility as the senior executive trying to help this state, or other leaders in our state, to provide access to testing, provide access to care, the right drugs, et cetera. But it is really each one of our responsibilities as a citizen to exercise our power to save lives, save our neighbors' lives, save our family's life. We know that spread is happening all over the country, from just tired of wearing masks, family gatherings, big events, people, parties, celebrations, people not doing the things that we know reduces the spread of COVID-19. And that includes getting tested. And I think that for me, as a very proud citizen of this great state, I know that people are tired. People have been doing a great job to date, and most people are still doing a great job. But despite us being a bit weary it is our responsibility to deal with COVID-19 in West Virginia. And we can do that by showing up to get tested, by wearing our masks, by physically distancing, by washing our hands, by avoiding crowds, avoiding places indoor where you're going to take your mask off, or where you don't wear a mask, or where you're around people you don't live with all the time. Those are the places that people get COVID-19 and that spread COVID-19. And so West Virginia, I know that we've said this in a bunch of different ways, and we've said the same message over and over again, but it is really the way that we are going COVID-19 to continue to thrive as a state is for each one of us to exercise our rights and responsibilities as servant leaders for each other and do the things that protect you, because by protecting yourself, you protect each other. And no matter how many test sites that we open, no matter how many beds that we can offer in our hospitals, we don't want to see a single person get sick. We don't want to see a single person die from COVID-19. And we're seeing that happen all over this country. Let's not have it happen here in West Virginia. Thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As Governor Justice mentioned, we have a significant amount of activity going on today and throughout the week. Several sanitization missions, but the major movement are testing lanes. Today, we are supporting 40 testing lanes in 19 different counties. So a lot of movement of forces back and forth to be able to accommodate all that activity. A lot of logistical support going on in place behind the scenes. In addition, we have 80 service members who are supporting local health departments with contact tracing and epidemiology support. And as we approach the election, we have 10 National Guard personnel on state status supporting the Secretary of State's office and the State Office of Technology with cybersecurity initiatives to protect our election. So as the governor, Dr. Marsh pointed out, a lot of people from local health departments, DHHR, the National Guard, and others putting in a significant amount of effort. Please go out and take advantage of the testing, and please wear your mask, and let's continue to mitigate this spread. Thank you.
All right, thank you, General Hoyer. Bill Crouch, Secretary of the West Virginia DHHR, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. I asked this last week. I'm probably going to be a parrot on this to some extent over the next couple months because, our CARES Act money, we only really have a couple months left to use it anyway. And based on the auditor's website, it looks like we have maybe about $850 million left. Last week, I asked specifically about the possibility of grants for nonprofit organizations for their coronavirus expenses, similar to what Ohio's doing. And I also asked about broadband. I know that you cut a check last week for the Thundercloud project out of that 50 million CARES money. So I was curious to know if we were going to see any other announcements on broadband initiatives through the CARES Act money or possibility of nonprofit grants. Thank you.
Stephen, I think that there's a first responder, and it's a SIRN network that's going to be coming out next week, and or maybe it came out late this week, but I believe that it was 21 million. Is that correct on broadband? I believe. And so that's an additional announcement, that we really haven't made yet, along with the Thundercloud announcement. But Stephen, the dollars that are there, I think we're down now to where on the CARES money that we see everything is bucketed and everything is going out of the buckets and everything, and it has to stay right there until it goes out of those buckets. The perfect example is, there's 287 million that's sitting there that's going, that goes back to replenish the workers' comp fund. There's 400 million is sitting there, that is to pay the workers' comp payments through the balance of the year, but we don't need all of that, and And you know, I'm sorry, I'm saying workers' comp, but it's the unemployment fund. I'm sorry, but nevertheless, we're down now on the CARES dollars to about 80 million, not 800. We're down to about 80 million that is, you know, really non-committed at this time. But now just think about this for just a second, Stephen, and that's why, you know, I'm the business guy in this. The testing that we're doing right now, to give you an idea of the cost of the testing, and I don't know exactly what it is, but the testing forever was, you know, $100 a test was the cost. And I think we've got it a little less than that in some locations and everything. But now just stay with me just 1 second. If we test 12,000 people a day, the cost of that testing is $1,200,000 a day, or right at it. So we've got to have a little buffer, and that's what we've done, you know, with the CARES money. Now you're still seeing a large amount of money that's sitting there, but those monies are committed. Those monies are going places and going out, you know, and going out just like this announcement of the 21 million that we just haven't quite made yet. I mean, for crying out loud, you know, it's just, we're watching out on our schools, you know, in every way from the standpoint of having to maybe, you know, expand testing or put more money in there in any way that's needed. I mean, we're on top of that, Stephen. We're on top of it, and we're going to stay right on top of it.
All right, thank you, Stephen. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. A question for Major General Hoyer. I know this is not directly COVID-19 related, but with the elections tomorrow, there are some concerns out there that there could be some uprisings and not so nice activities going on around the country. I was wondering if the West Virginia Guard could be called into action to help settle things down. General?
So, Paul, we're always prepared for missions that we're asked to do, but I would tell you it goes back to, if you're talking about West Virginia specific, goes back to early on in the pandemic when people were concerned about whether we needed support to law enforcement for issues early on. West Virginians are pretty daggone good about taking care of each other and doing what they need to do, and we don't see any particular need at this time right now for any National Guard support to law enforcement in the state of West Virginia, and we don't see that we would be tasked for anything outside of the state of West Virginia.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi, I'm passing along a question from some readers who are curious about tomorrow. Are any of the schools that operate as polling places in danger of being closed tomorrow, either because of outbreaks or because of their map color? And then conversely, if not, what steps do you take to keep those places open on Election Day? Thanks.
Okay, Bill, maybe could you take this, or do you know more about this than I?
Yes, sir, Governor. I know of no schools, if I understand the question properly, no schools that are going to be closed for voting, that are utilized for voting because of cleaning the schools, maybe because of an outbreak. If I understand your correction or your question correctly, David, there are no schools that I'm aware of. We'll double check that. It's a good question, but most of the school cleaning has been done in individual classrooms. Schools are rarely closed down entirely. It's the area that an individual who was positive is closed for cleaning. So I would say that there will be no schools closed that are scheduled for voting.
And let me add one thing, David. I think really and truly the local county clerks, you know, are where you probably need to check on this. You know, I think they're in charge of the entire show there, and so I think they're the ones to check with that on.
All right, thank you, David. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. Let me tell a personal story because I think this is the best way to frame my question, because I think thousands and thousands of families are in the same dilemma as mine. My wife and I were planning to fly to South Florida for Christmas, and our kids were going to fly in from California and Rhode Island, and we were all going to meet in South Florida. Well, we can't do that because obviously Fort Lauderdale's a huge hotspot now. Now we're thinking of inviting our kids here, and they're reluctant to come. And telling my sad tale of woe, what's your advice to families like mine about Christmas and Thanksgiving? I mean, there have got to be thousands and thousands of West Virginia families struggling with the kind of decision that we're trying to make right now. What's your best advice?
Well, Mark, it's it's a tough call. There's no question about that, and I share in your concern. I also want to tell you just this, that we've got to go ahead and live. I mean, that's all there is to it. And we got to continue to do, just call on all the resources that we have. I mean, I think the airlines are doing a phenomenal job right now, and they're having great successes, with people moving around on the airlines. Is much limited, much more limited way. But I think from the travel standpoint, it's probably okay to do. I think from the standpoint of how you have gatherings as a family is a really, really, really big issue throughout this entire country. More of an issue than it would be of going to an event, that had hundreds of people or a ball game or whatever it may be. Because, with a family gathering, you are with those people for an extended period of time, probably right up within, in somebody's face, no mask and everything else. All I would say to you is you've got to take all the necessary or all the precautions that all the medical experts have told you over and over and over. If my kids were in California, and I wanted to be with them, over Thanksgiving, West Virginia is a safe place and everything, I'd ask them to run out and get a test where they're at. If they tested negative and everything, I'd bring them, I'd have them come and then maybe take the precautions of taking their temperatures and everything, and maybe make sure that everybody here ran out and got a test also. Mark, I can't tell you any more than just staying really in tune with all the news and all the stuff that comes out all the time. It's a heck of a tough decision. I mean, it's just tough stuff. And, and in my situation, no matter what I tell you, I can't be right about anything, that I tell you absolutely 100%. But I would tell you that the downside of us all just crawling in a hole right now, the downside has big time repercussions too. And so we got to just do the best we can do. I mean, that's just when it really boils right down to it. Take every precaution you can take and do the best that we can do. I don't have a magic bullet. I don't have a magic cure. But I can report one other thing really quick, and that's just this. I had a conversation that was night before last with a gentleman that's a really very distinguished, high-ranking doctor at Johns Hopkins. And we were talking about, a vaccine, and you could tell all over him that he was just really worked hard and stressed to the max, and really sad about the number of people that they were losing and that they were dealing with and everything else. But he really had encouraging words on the fact that, and I think it was Pfizer, I'm not sure, but he thought they were going to be the first to come out with the first vaccine, and he was really encouraged that it wasn't very far away. And by not being very far away, maybe even as close as the end of November rather. but maybe it was coming out with the first absolute finished trial and everything, but we're getting closer, Mark. I can't tell you more than that. I know we all are suffering through the same thing. For crying out loud, it's just, nobody signed up for this deal. I mean, that's just all there is to it. It's a pandemic that a lot of us are walking around saying, it's not going to happen to me. It's not going to happen to me, and it's hard. It's hard to get some people to just be serious, and it's hard to get other people to not be numb about it and just think, I'm not going to pay attention to it. It's hard to get us to test. It's hard on our families, really hard. It's hard on all of us. So that's all I can give you. I'm speaking from my heart. I'm not speaking from a bunch of notes. I think, if you'll follow the best precautions that you can possibly follow, and know that if by chance, and God forbid that things don't work out and somebody does get sick and everything, there's drugs and there's people that are standing in the wings trying to help in every way there too. So I think we've got to keep on living, and that's just all there is to it.
All right, thank you, Mark. Governor, I'll turn it back to you.
I don't really have anything else. I made one note today, and the note was in regard to CARES monies that we have that we're setting on. I think you're still setting on between $60 and $80 million, closer to 80, and that keeps going and going faster and faster and faster. If you look at our cities today, our cities and our counties, I think we're at 169 million, and I want to make just triple sure of that real quick. But at 169 million, and we started out and bucketed 200 million for them. And so I think that's not right. I'm not going to look through all this, but I think that was right. And so if you're at 169 million, you got to make it through November and December. And we only got $31 million to go right there. So as we do this, these dollars are sitting there in buckets. It is preposterous to think, that you got hundreds and hundreds of millions of dollars just sitting there. That's ridiculous, and we don't have that. But what we've got is what I told you. We've got about $80 million plus or minus, that's sitting there. We've got a daily potential spend. If we really test 12,000, and we really should try to test 20,000. But if we really test 12,000 people, not only what will that give us? Well, here's what it'll give you. It'll give you West Virginia. It'll give you just absolutely just this right, straight, period. It'll give you the ability to go to school faster. It'll give you the ability to play ball faster. But what it'll give you more than anything in the world, it will give you the ability to stop this thing. And it'll give you that ability because we will find people that are asymptomatic. Now, I got to say this one more time. West Virginia, from the standpoint of your governor, that is absolutely willing to commit as much as what we're talking about here could be $1,200,000 a day to facilitate and do this testing. Now, with all of that, if you don't show up because of things like, well, I don't want to know if by chance I could be positive. Well, the odds are you're going to know because you're going to get sick. And if you don't get sick, the odds are you're going to make somebody else sick. And the last thing is just as simple as just this, is you could very well be in a situation to where you don't get sick, and maybe you are fortunate enough that you don't make someone else sick. But down the road, their odds are astronomical against you from the standpoint that you could end up with some chronic problem, a heart or a lung problem that could follow you the rest of your life. There is no reason to not get tested. It takes no time. The effort that the National Guard, DHHR, the local health department, all the people that are doing it, the effort that these people are doing and the monetary effort that is going on right now, if you'll just go get tested, it's simple as mud, but if you don't, I don't know what else I can do from the standpoint of trying to slow this thing down. You got to help me. You got to help me from the standpoint of the superintendents or the coaches or, you know, the local fire department or the, you know, first responders or the media or whomever. You got to help me go get people tested. And so with all that, the only note I made was the cost of the testing. And I would tell everybody, tomorrow you have the ability in this state to exercise a right that countries will absolutely go to war over, and they will fight to the death over. You have the ability to go vote. Now exercise that ability. Exercise the right of who we are as Americans. Go vote. It is an absolute incredible honor that we have in this country, and exercise that right. But we'll be back to you real soon, and let's just hope and pray, you know, that some way we're going to continue to get through this. Thank y'all.